How do you recommend a practitioner tell someone to use the EC3 mold plates? If they think they muscle test and found some mold, how should they tell them to test?
Best practice would be to just buy a 6 plate test kit. I think it's like $36. I mean, it's not that expensive. It comes with 6 plates, and we kind of recommend doing a air test and a tap test in the rooms where you spend the most time. So that would be opening one of the plates and setting it out on a table somewhere not way high up, but not too close to the floor. I
Right.
mean, maybe try to just get it in the middle of the room and set it out for an hour. And then you close it and let it culture for 5 days to see what grows. And in that same room, like say you have a large couch or a rug, especially if you have wall to wall carpet, do a tap test on that as well. Because those larger items, especially if they're upholstered, they tend to be like a filter for a lot of mold spores. And most of the water damage mold tends to fall to the floor or fall to a surface quite quickly. So if you do a tap test and an air test, you can get a pretty good idea of what's going on in those rooms. And you're looking for the plates not to culture more than about 4 colonies. I mean, it would be rare to have a completely like no growth at all, especially if you're living in the house and active and things like that. Just because you have a high count on a plate doesn't always mean that you have like an intense mold problem. It could mean that you just have contaminated carpet. So,
Right.
the plates are a good place to start. They give you the idea that you need to do further investigation, or like hey, this room is okay, but then our bedroom is terrible. So like what's going on in the bedroom, So it can help you narrow your focus and even just start employing some mold specific cleaning to what you're doing and seeing if that makes a difference. They're just kind of cool because you can test frequently and monitor without spending a ton of money. So
Yeah, we love that setup. And what I'll tell patients sometimes is like get the kids involved, especially if you've got a homeschool group, your homeschool, make it a little science experiment of like what areas grow, what's going to grow in the plates. But we'll have patients buy 2 or 3 kits of it, right? Like 12, 18 plates. And then, tap test every room, air test every room, tape it to the vents, check your nose, check your clothes, right? And so just like you said, it'll help you narrow down, if your living room's got a couple of spores, not a big deal. But if your bedroom's got 20, well, then we're thinking like we might be getting close to our source.